Welcome back. In this lecture, we will describe the process of mastication. That's mastication as the first step in digestion. We will examine the process of physical digestion and see how the salivary glands are necessary structures to the process of chemical digestion. And finally, we will locate and describe the esophagus, and we will see how that atomic structure is an important part of the digestive system. So let's get started. Mastication is the process by which food is crushed and ground by the teeth. Now, during the process of mastication, you use your cheeks and tongue to position your food between your teeth for grinding. Sound familiar? Well, okay, mastication is just a fancy word for chewing. Now, mastication effectively increases the surface area of food, allowing for more efficient breakdown by enzymes during the process of chemical digestion. Now, in the last lecture, you learned the term occlusion. Remember that occlusion is when you close your mouth and your maxillary teeth marry or occlude with your mandibular teeth. Now recall that the cusps of one tooth fit into the foci or grooves of its opposing tooth. When that happens, your teeth act like a bunch of little tiny mortars and pestles. You know what a mortar and pestle is? Now you've seen these before. You may even have one in your kitchen. They're used to grind up spices and herbs, or even to make delicious guacamole. Now, mastication is the first step in the process of physical digestion of food. It involves the facial muscles of mastication. We'll learn about those in the next section. You use the cheeks and the tongue to position food between your teeth, and then you use your teeth to crush and grind the food. Now, crushing increases the surface area available for contact with saliva. So why is that important? Well, saliva is important for two reasons. One, saliva is composed of about 99% water and contains, among other things, mucus, which coats and lubricates food to aid in swallowing. And second, saliva contains enzymes, namely amylase and lipase, which mix with food and begin the process of chemical digestion. Now, saliva is produced by your salivary glands, and there are three pairs of salivary glands. Now remember that the human body is largely symmetrical, so there are three glands on the right side and three identical glands on the left. Now your salivary glands are named according to their location, and so we have the parotid gland. This is the largest of the salivary glands, and it is positioned just in front of the ears. The submandibular salivary gland is the salivary gland under the mandible. Submandibular, under the mandible. And the sublingual salivary gland? Exactly, that's the salivary gland just under the tongue. Now, saliva flows from the glands and into the mouth via the salivary ducts. Now, you can see your sublingual salivary glands by looking in a mirror and lifting your tongue. And so you see them here and here. Now, you don't actually see the duct openings, but if you lift your tongue and liquid squirts out, well, then that's saliva being ejected from the sublingual salivary ducts. So remember I said that your saliva contains enzymes that start the chemical digestion of your lunch. So here's a quick word on enzymes, just so you're not confused by the terminology. Enzymes are proteins that catalyze or speed up biochemical reactions, like, for instance, digestion. Enzymes are named according to the substances upon which they act. Now, the names of most enzymes end in ASE. AMYL, amyl, is the root word for starch. So amylase catalyzes the digestion of starchy foods, like those fries that this kid is eating. Likewise, lip, or LIP, is the root word for lipid. So lipase catalyzes the digestion of lipids, or fats and oils. So saliva contains chemical enzymes like amylase and lipase to begin the chemical digestion of your lunch as you chew your food. Now, as saliva with its enzymes and mucus mixes with the ground up food, a mass called the bolus is formed, and it is this bolus that you end up swallowing. So once again, for reference, here is your nasal cavity. Your oral cavity is here, the tongue is here, and this is the spinal column, or backbone. Now, as you commence swallowing, there are two openings at the back of your throat, or the area we call the oropharynx, which lead into two passageways. There is the trachea, or windpipe, which carries air to your lungs, and there is the esophagus, some people call it the gullet, which carries food to your stomach. So how does your body keep your food from going into your windpipe when you swallow? Well, sometimes it doesn't, and that's when you get choked. but there is a little flap of tissue called the epiglottis that closes off the trachea when you swallow. So if everything is working properly, and it usually does, the bolus enters the esophagus and heads southward to the stomach. So here's a detailed look at the epiglottis in action. Now you see the bolus here in green. Note the position of the epiglottis. It's up, which allows air to pass into the airway. But as you swallow, the epiglottis shifts down, effectively closing off the airway and allowing the bolus to pass easily into the esophagus. Finally, here's a quick word on the esophagus. Esophagus is a flexible tube. It's about 25 centimeters. That's about 10 inches long in the average adult. It connects the oral cavity to the stomach, and its job is to carry the bolus to the stomach. Now in the next lecture, we will review the information covered in this section, and then you will be ready for your first quiz. For now, and future reference, the quizzes are 5 multiple choice questions long. You can take them as many times as you want, and I've even included a reference there for you so you can go back and review the appropriate information. So good luck on your first quiz, and I will see you back here for section 3.